Good day everyone, I am Mylene Remondes, student from Golden State College of Malongon. Some of the Filipinos are the problem is health. In today's video, I am going to discuss to you what are the causes of health problems. Health problems can be caused by a person's genetic makeup and lifestyle behaviors. First examples, overweight and obesity. Overweight and obesity are defined as a normal and excessive fat accumulation that present a risk to health. A body mass index or BMI over 25 is considered overweight and over 30 is obese. Second example is tobacco. Smoking causes cancer, heart disease, stroke, lung disease, diabetes, and chronic obstructive and pulmonary disease. Third examples, substance abuse. Substance abuse refers to use of selected substance including alcohol products, drugs, inhalants, and other substances that can be consumed and inhaled or injected. Fourth example, mental health. Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make healthy choices. Fifth and last examples, environmental quality. Environmental quality, which can refer to varied characteristics such as air and water purity or pollution, noise, access to open space, and the visual effects of buildings and the potential effects which such as characteristics and may have physical and mental health.
Good day everyone, I am Trinjin Estagnan, student of Golden State College of Malongon. Today, I'm going to discuss to you what are the possible red flags on autism child. But before that, I'm going to discuss first what is autism or autism disorder. Autism disorder is a developmental disability caused by differences in the brain. People with autism often have problems with social communication and interaction and restricted or repetitive behaviors or interests. Autism disorder, it typically appears in early childhood and parents and caregiver may notice signs and symptoms as early as 12 to 18 months of age. If you are concerned that your child might have autism, here are some signs to look out for. First, lack of eye contact. Children with autism may avoid eye contact or have difficulty maintaining it. And second, delay speech and language skills. Children with autism may not be able or use gestures, and they may not speak words by 16 months. Next is repetitive behaviors. Children with autism may repeat certain actions or behaviors such as rocking or flapping their hands or lining up toys, and they may act upset if the sequence of their repetition is interrupted. They may also repeat certain sounds, words, phrases, or even full message. Next, difficulty with social interaction. Difficulty with social interaction may struggle to engage in social play or make friends, and they may not respond to their name being called. And the last is sensory issues. Children with autism may be overly sensitive or undersensitive to certain stimuli such as loud noises, bright light, or certain texture. It is important to remember that all children with autism will exhibit all of these signs, and some children without autism may exhibit some of these signs as well. However, if you're concerned about your child's development, it's always good idea to speak with your pediatrician or specialist in developmental disorder. That's all. Thank you.
Good day everyone. I am Shane Artoran, a student from Golden State College of Malone. And today I am going to tackle to you about a child who have autism spectrum disorder and how her parents handle her. Before we proceed to the child's case, let me introduce to you first what is autism spectrum disorder. Autism spectrum disorder, or ASD, is a complex neurodevelopmental disorder that affects communication, social interaction, and behavior. It is called a spectrum disorder because it can manifest in a wide range of symptoms and severity levels, leading to significant individual variations in how it affects people. So, let's move to my main topic, raising a child with an autism spectrum disorder, or ASD. Jack was referred a comprehensive psychological evaluation due to concerns regarding developmental delays, social difficulties, and atypical behavior exhibited at home. The primary concern is the possibility of autism spectrum disorder. Jack is a 4-year-old boy who lives with his mother, Leah. At the age of 2, he was diagnosed with pervasive developmental disorder, not otherwise specific, or PDD-NOS, a less severe form of classic autism. During the assessment, Jack displayed difficulties with maintaining eye contact, limited social interaction, repetitive behaviors such as hand flapping, and showed a preference of routines and sameness. They exhibited challenges in understanding and responding to social cues and demonstrated difficulty with verbal and non-verbal communication. Here are his mother's statements.
Devastating. It was, we call it functioning denial. We heard them, and you don't want to believe it, but you have to run and do everything you can. Everything that you read says between the ages of 2 and 3, that's the most critical. Well, 2 and 4 really is the most critical time to make a difference. So we just started trying to get as many services as possible.
Leah was 9 months pregnant with her second child, Joey, when she found out that Jack was on the spectrum.
We're concerned now, do we have another child? Jack needs so much from us that, I think it'd be too much. So I'm glad that we were already pregnant and did it and got it over with, because we probably would have had second thoughts. We've been more vigilant in making sure he hits the milestones now that we recognize any red flags. We weren't aware of any of them before, so now we know what to look for. And that was another reason, obviously, we participated in the infant sibling study, because we want to help find any possible reason or cure, but we also did it so we can kind of monitor his progress.
How is Joey developing differently than Jack did at his age?
He, we'll sit him down in his high chair with a spoon or a utensil and food, and he'll feed himself. Jack still needs assistance. Language, he can communicate with us and tell us his needs, where Jack didn't say mama at the age of 2.
You need me to open it? Yeah. Okay. Are we all done blocks? All done? No?
Jack still has a lot of safety issues where he doesn't understand, the consequences to running in the middle of the street. And Joe does.
What is Jack and Joey's relationship like?
Joe interacts so much with Jack and tries to initiate play so often with Jack, he kind of wears him down. A lot of it is Joe's the baby brother and he's annoying to him sometimes, which is kind of funny because that's a typical behavior, so it's great. The sharing piece, when they fight over sharing certain toys, I kind of appreciate it because good, that's what he's supposed to be doing.
Coming to terms with Jack's diagnosis.
Every time we go to, whether it's his pediatrician or his developmental pediatrician, we always have a question. Could it have been the chemicals I was inhaling? Because they did work with a lot of, acetone and a lot of different wood manufacturing materials. Could it have been, I don't know, something that we were exposed to or something that we didn't do with Jack when he was an infant? Or was he not getting the right vitamins? I think you kind of have to just say, well, we're here. So there's no looking back now. You kind of have to just move forward.
So, after watching Jack's mother's statement, it is really important to note that every person with ASD is unique and their experiences and needs may differ. Early diagnosis and intervention can help individuals with ASD receive the support and services they need to thrive and reach their full potential. Treatment and interventions for ASD often include behavioral therapies, speech and language therapy, occupational therapy, social skills training, and educational support tailored to individual needs.
Hello everyone! Good day! I am Grazel Maysibial, a second-year BEC Ed student from the afternoon session. Before anything else, did you learn a lot from the previous reporters? Yes, of course! Therefore, this time, I'm going to introduce to you another exciting topic that discusses disability matter. But, before we jump into our main discussion, I would like you to see some pictures first. And then tell me, what do you think our next topic would be all about according to these pictures? Alright, our topic for this time is all about the different types of learning disabilities. Now, let's define first what is learning disability. Yes, learning disability is a neurological disorder. When we say neurological disorder, it involves the brain. In simple terms, a learning disability results from a difference in the way a person's brain is wired. It is a disorder that impairs one's ability to recognize and employ written or spoken language, perform mathematical operations, sync up movements, and pay close attention. Every while, learning problems can arise in young kids. They are typically not identified until the kid is old enough to attend school. It is possible for learning deficits to learn a lifetime because according to a research, this type of disability can't be cured nor fixed. In other words, it is a lifelong issue. But of course, we can still help kids with this type of disability. And special education is the most widely used treatment for this. Alright, now let's proceed to our main topic, which is the different types of learning disabilities. We will be discussing 5 common learning disabilities such as dyslexia, dyscalculia, dysgraphia, auditory and visual processing disorders, and the non-verbal learning disabilities. Let's begin with what is being called dyslexia. What does it mean when we say dyslexia? Dyslexia is a language-based disability in which a person has trouble understanding written words. It may also refer to as reading disability or reading disorder. It is also said in a research that it can possibly caused by genes and heredity or emotional and physical trauma and poisonous substances. What does dyslexia look like? In class, students with dyslexia may read more slowly with more effort than other peers. They are more likely to make many mistakes when reading aloud and having trouble with spelling. There are also those who guess words instead of reading them. So if you notice someone with these difficulties in your class, that student might have dyslexia. But it doesn't mean they find it hard to learn, they are stupid. No. According to a study, they are just using their mind differently. There is actually a short film about this entitled Mikal. I think it was released in 2020. It's a great film, I can say. You would probably learn a lot. And you can watch it so you will understand more and become aware how to see and deal with people with this learning disability. So after watching it, I realized the importance of observation and trying to understand a person's action before judging and get carried out by emotions. Next, let's discuss dyscalculia. Dyscalculia, it is a mathematical disability in which a person has a difficult time solving arithmetic problems and grasping math concepts. Unlike dyslexia that tackles the difficulty in reading, dyscalculia, on the other hand, refers to having trouble with mathematics. That's why it is also known as mathematics learning disability or disorder. To give you more idea, dyscalculia is like having difficulty with counting money or making change, solving math problems, like that. People with this disorder often encounter mental issues when they have to do math, such as anxiety, depression, and other difficult feelings. Now, let's proceed to the third type of learning disability, which is the dysgraphia. Now, what is dysgraphia? Dysgraphia, it is a writing disability in which a person finds it hard to form letters or write within a defined space. In the class, you can determine a child with dysgraphia if he or she has poor letter formation, awkward pencil grip, illegible handwriting, writing letters in reverse, avoiding writing and drawing tasks, and so on. In simple words, dysgraphia affects the person's ability to write. Next, we have the auditory and visual processing disorders. What is auditory and visual processing disorders? Yes, it is a sensory disability in which a person has difficulty understanding language despite normal hearing and vision. So that is what we call the auditory and visual processing disorders. And lastly, we have the neurological disorder, which originates in the right hemisphere of the brain, causing problems with visual, spatial, intuitive, organizational, evaluative, and holistic processing. It is called the non-verbal learning disabilities, or the NVLD. The characteristics of this disability are poor coordination, difficulty comprehending nonverbal information, reading comprehension issues, social difficulties, spatial work, memory deficits, and as well as difficulty with transitions. On the other hand, some children with this type of disability may struggle with using scissors, tying shoelaces, and even bumping into people or things. Those are the common learning disabilities. So that's it. You can do further research about these types of learning disabilities to acquire more information. So I hope you learned a lot from our lesson for this time. Once again, this is Grazel Maysibial. Thank you for watching and bye!
Good day, especially to you, Ma'am Glyza May P. Porcadilla. I am Mary Claire Osan, student of Golden State College of Malungon. So, I am going to tackle about ADD and the common characteristics of ADD. So, ADD stands for Attention Deficit Disorder. It is a neurodevelopmental disorder characterized by difficulties with maintaining attention, controlling impulses, and regulating hyperactivity. People with ADD may struggle with staying focused on tasks, organizing activities, and completing tasks. It can impact various aspects of life, including work, school, and relationships. Some examples of behaviors associated with ADD is difficulty paying attention to details or making careless mistakes in school or work tasks, inability to sustain attention in tasks or activities such as conversations, lectures, or reading. So that is the examples of ADD or Attention Deficit Disorder. So let's proceed to common characteristics of ADD. So there are 3 characteristics of ADD, which is diagnosis, treatment, and fear of labeling. So for diagnosis, if you notice your child has been diagnosed with ADD, there are 5 several strategies you can use to help them manage their symptoms. First, establish a routine. Second, break tasks into smaller steps. Third, provide clear instruction. Fourth, minimize distraction. And last, use positive reinforcements. By implementing these strategies and providing ongoing support, you can help your child manage their ADD symptoms and thrive in school and other areas of their lives. So, for treatment, treating attention deficit disorder typically involves a combination of medication, therapy, and lifestyle changes. Here are some ways you can help your child manage your ADD using treatment. First, medication, behavioral therapy, parent training, lifestyle changes, and the last is consistent routines. By utilizing a comprehensive approach that combines medication, therapy, and supports, you can help your child effectively manage their ADD symptoms. Last, fear of labeling. Some parents frightened that if they have their child tested for ADD symptoms, she will be labeled. So as a parent, you can do a lot to prevent this from happening. Helping your child with attention deficit disorder while addressing the fear of labeling involves several key approaches. First, focus on strengths. Second, normalize differences. Third, foster self-awareness. Fourth, encourage open communication. And last, promote resilience. So that is the 3 common characteristics of ADD, which is diagnosis, treatment, and fear of labeling. That's all. Thank you.